Hi, my name is Stephanie Nolting. I'm a physical therapist at PT Connections, and we see a lot of people that have joint replacements, from knees to hips to shoulders. And some of the common problems that people see is having pain right after surgery. Now, a lot of times, if you have a nerve block right after surgery, the first couple days is pretty spectacular as far as, oh, pain is well controlled. But then after that comes reality of, oh, okay, there's a lot of pain associated with healing. So, the pain can be significantly reduced if you really pay attention to how much swelling is in the area. And so the quicker you manage the swelling and get the swelling out of the body, the less pain you will have. When you have less pain, it's a whole lot easier to start regaining your strength and range of motion and getting back to normal activities in life. So for people that have a lower extremity issue, making sure you get the knee above the level of the heart, you'd want to lay flat on your back so that your legs are higher than where your body is. So a lot of people go, oh, does that mean I can't be in my recliner where my back is up and my legs are up? Yeah, that's not ideal. It's good, but it's not ideal. Because if you're in that V position and the fluid drains out of the knee and settles in the hip, and then you stand back up again, it drains right back into the knee. Um, if it's a hip issue, having the legs elevated will help drain some of the swelling that just came down the leg with gravity during the day and let that circulate into the body cavity so the body can put it into the bladder and the bladder can get rid of it. If it's a shoulder replacement or swelling, having the arm, depending on restrictions of the surgery you had, you may have to passively put your arm onto something like the back of a couch or a table, and a lot of people don't have this much motion right after a joint replacement. They're usually here. So if you're far enough out that you can get it there, then you can do this in sitting, and you can wiggle your fingers and pet your arm and get fluid to go towards the heart. If you're much further down, where most people are right after surgery, you can lay on your side. And when you're laying on your side, then your arm is automatically above the level of your heart. And you can wiggle your fingers and move your hand around to help pump the fluid out. Um, Same sort of thing if you're wiggling your toes rather than your fingers. If it's a lower extremity injury, that definitely helps evacuate the fluid faster because our muscles work as pumps to help push fluid in the right direction. So if you're going through a replacement, best of luck to you. I hope that helps. And if you need us specifically and directly, our phone number is 719-565-6678. Best of luck.